Now, another thing that you talk about, and I want to get into that's a controversial chemical, is fluoride. We still use it in the US in our water supply a lot. And we actually wrote an article about fluoride at our company recently and the pineal gland calcification. You brought up the pineal gland before also. And there's so much research into the dangers of it. But I've still heard some dentists, even on the biological realm there, that said if you have really bad teeth, that they could still use fluoride 1 to 2 times a week locally, of course, in fluorinated toothpaste to help with cavities. Would you agree with that? Would you ever introduce fluoride into any patients, even with really bad teeth? Never. You're shaking your head like, no.
No, no way, man, no way. It's super toxic stuff.
I
No
know.
need for this. So your teeth are not like problems with your teeth are 100% no chemical deficiencies. So we have to look at maybe nutritional deficiencies and your lifestyle. But this is one thing none of our patients would ever use a fluoride toothpaste. Of course, this is what you learn in university, and this is done for 30, 40 years, and it's probably biased, whatever. It is a strong disinfectant, and if you think that any inflammation in your mouth is because of your immune system going berserk, it's because of infections, and you have to disinfect them. This is the common belief. If you have to disinfect now your hands and stuff, of course, then you use stuff like this, or also like chlorhexidine or stuff in your mouth. But if you see that your body and your mouth has an oral microbiome, like think about this, like your skin, it is the biggest microbiome in your whole body is in your mouth.
Mm-hmm.
Why would you disinfect it on a regular basis? That makes no sense at all. You would rather nourish it and take care of it and make sure that all these bacteria, whatever lives in there, they're not bad or good. They just
Right.
have to live in harmony and be balanced, and your immune system has to kind of like juggle it. And we don't want to have, of course, compartments. We don't want to have dysbiosis because of metals. We don't want to have dysbiosis because of root canals. We don't want to have dysbiosis because of cavitation and all the other things. It really smells like you cannot imagine, like the sewer in New York City, maybe down there, like where the turtles live. Yeah,
That's bad. That's bad.
that's how it smells with some people, of course, because it's really nasty. The research is pretty clear. If you have mercury in your mouth, you had it, it kills the good bacteria, it kills it further down your gut. You end up having dysbiosis. Fungi like mold come in, candida comes in, and parasites also come in because they help you with the heavy metals, but they want your energy and it smells. Will be different. And if you have metals in your mouth, most of the time you have an inflamed gingiva. Like your gingiva will be a little bit reddish, a little bit bleeding, and I refer to this as leaky gum.
Mm.
Same as leaky gut, but starting already in your mouth, leaky gum will open the doors for autoimmunity, for like undissolved, undigested stuff coming into your system already in your mouth. Periodontitis is an open gap to the inside of your body every day, 24 hours, 7 days a week. It's insane what you can see there. So really, health starts in your mouth. I can just, yeah.
No, I mean, I totally agree, and it's good to hear you talk about these things and kind of put your foot down because some people say, yeah, you can use a little fluoride here and there, it won't hurt. Most dentists, are taught that fluoride is a part of the dental, toolkit. But if you're saying no fluoride ever, of course, what would you look for? What would you recommend to people looking for what kind of toothpaste should I use?
Just think about it totally logically. What would you eat? Would you eat fluoride? No. Why would
No.
you put it in your mouth? So I would just go to Whole Foods or any sort of good, how you call it, like a natural supermarket or,
Yep.
yeah, and find a natural toothpaste. You should look for no chemicals. Like
Hmm.
most of the toothpaste, besides the fluoride part, are white. White is titanium oxide most of the time. It is a white color called E171. Try to skip this. This is also an immune system disruptor, really toxic. So I would go with something, maybe a coconut base.
Hmm.
It could be activated charcoal. It could be bentonite in it, mixtures of herbs, as natural as possible. So there are lots of, in the biohacking realm, there are lots of DIY toothpaste and things online. Most of the time they use some sort of coconut oil as a base for it. This is what I would do, or just find something in the local supermarket, a natural supermarket. There's good things that I found at Whole Foods already. maybe not perfect, but I'm not a perfectionist. I would just look at better than yesterday, like make it a little bit better every day.